One second, I think. Okay, so welcome everybody. So today I'm going to take you through some of the recent research advances in health informatics and big data, and how we can use health informatics and big data to improve healthcare services. So I'll start with the basic definition of a health system. So in order to understand the impact of healthcare informatics and the use of big data, including AI, to improve healthcare systems, we need to understand the basic concepts of what is a health system. So a health system is all the institutions that are dealing with healthcare services, including the people, the actions that these people take in order to plan their healthcare services. And the aim of the institution, the people, the action, the use of technology, and so on, is there to improve the health of the people that they are serving. So the main components of a health system is as I said, the people who are governing the healthcare system, the financial assets that they are using, the budget that they use in order to provide the resources for their healthcare system, the services they are delivering to their health population, and the objective is to put all of these resources together to have an integrated healthcare system, as you can see in this figure. The problem with healthcare is that most of the governance that are used today in healthcare are unable to deal with or to optimize the budget that are allocated to healthcare. In the curve here, you can see that the healthcare cost is increasing significantly from one year to another. Even though for those countries like the US, North America, US, Europe, a very, very developed country, they are struggling to keep their budget aligned with healthcare services. Every year they see that the healthcare services cost is drastically increasing. So for example, for the US, we have something like $3.7 trillion per year spent, with an average of $11,172 per person. That is in 2018. And these numbers have increased, and now I think we are around $4 trillion in the US. In 2019, there was $260 billion per year spent that was spent in Canada for healthcare, with an average of $7,668 per person. So this increase in the budget is making the healthcare system non-sustainable, which means that if we keep spending money in healthcare like this, maybe in the next few years, we will not be able to care about everybody, for everybody. And therefore, there should be a new ways of using the technology to reduce the overhead. So in addition to the cost, we have an increase in the prevalence of chronic diseases, which means that the number of diseases, although we are spending a lot of billions of dollars in healthcare, the number of chronic diseases are increasing. So there's a substantial part of the overall healthcare cost is on overhead. And that's where IT can play the role, is how to reduce that 30 to 40% of the overhead. What I'm trying to say here is that, for example, out of that $3.7 trillion spent in the US, 30 to 40% of that amount is overhead. Overhead is all the cost that is not going directly into the service that is touching on the patient. So it's IT, resources, all kind of other infrastructure that is not directly linked to the healthcare service, but it is a support service. So we need to, IT and AI is there to try to reduce that overhead. On the system, on the processes as well, there is a big problem with the healthcare. Most of the healthcare practices today are non-evidence-based type of care, which means they're not based on data, on evidence, and we are still doing things based on our own experience, as I'm talking about here about the healthcare service providers. So they are still relying on their own experience to provide healthcare services, but not on evidence-based and justified type of practices. There's a lot of poor communication, there's a little use of data, and there is a poor prediction prevention mechanisms for what's going to happen in the coming years and what we can do in order to prevent it. The IT also, the deployment of IT also, there is a lot of mismatch and misalignment of IT. In the same healthcare system, you may find 7, 8 different information systems, one for the imaging system, the other one for the healthcare booking systems, and one maybe for the nuclear medicine, another one for the EMR, the electronic medical record, and so on. And all of these systems, they don't talk to each other. There is a big disconnect in them. Each system is coming from a different provider, and each provider is using its own standard format for the data, for the imaging systems, for example, and so on. And therefore, there is a lack of integrated services because you want all these systems to work together and to communicate together, and then you want to have information cross-shared from all these systems. The next problem is the implications that all these misalignment of IT and then the standards, the way we're not making use of the data, the implications are on the social implications are very, very drastic. For example, the medical errors are the 3rd leading cause of death in the US. So there's still a lot of, although we are using a lot of IT and so on, I'm talking about the developed countries, they still, medical errors are still the main reason for as I said here, the 3rd leading reason for death in the US. Problems in tracking patient behavior, poor patient feedback. We are unable to track the patient behavior when they are outside the hospital, and then try to communicate with the patient in a nice way so that we know exactly what he should do, what he shouldn't do, how he should eat, how he should sleep, and so on. So how he should behave in order to avoid chronic diseases and so on. The role of information technology here in health system is drastic. And we can say that the information technology and all those information systems, including AI, health informatics, and so on, are the memory or the nervous system of any healthcare system. And we are going to see here in this talk how we can build those healthcare services to be efficient, to reduce the cost, improve the services, and then mainly prevent and predict things in the future so that we can take actions before they happen. And therefore, we save big budget for governments from preventing these diseases and chronic diseases and problems to happen. So the lack of information technology in healthcare system is due to the fact that most of this healthcare system is becoming fragmented. And therefore, the need for a change is there. So we need to change things at the scope of the care, at the scope level. Rather than to cure the patient, we want to care for citizens in the future. So which means that we change the focus from the patient to the citizens. The focus, in terms of focus, we want to go from the process to on the patient in the future. In terms of time, we want it to be, today is a symptomatic and curative. We want it to be predictive, preventive type and lifetime processes. We want to move from hospitals to decentralized healthcare. We want to reach the patient wherever he is, at home, all the citizens, wherever they are. And then the method, we want to move from an invasive to less invasive type of methods. In terms of the healthcare process, we want to move from personalized preferences. This is in terms of the healthcare service providers. They are related or they are practicing based on their preferences, personal preferences. Then we want them to move their practices and make them based on guidelines, evidence-based type of practices. And as mentioned earlier, we want to move from a fragmented, isolated processes to disease management type of processes, integrated and based on diseases. And the experience, we want to move it from individual to best practices and from manual to automated. So to conclude, we have to say that the health system requires change in the way healthcare is delivered, medical data is used and shared properly, medical knowledge is managed, transferred, in clinical practice. And that's what we call translational medicine, which means that we want to take this research that we do in healthcare and translate it into practice. And this is a very, very new and very challenging type of research area, which is the translational medicine. We can translate technologies in industry easily, but we cannot translate research, medical research to practice because we're dealing with humans. The way they acquire and they adopt such new practices in their life. So that's why the challenge here is different than applying new research advances in industry or other type of technologies. The main challenges here are the fact that we want to go from avoid the isolated fragmented information. We want these are the main challenges of today's healthcare systems. Most of the information is incomplete, inconsistent, missing, and a lot of pre-processing needs to be done on the data, on the healthcare data, for it to be ready to be used by AI systems and other health informatics systems. Bad information presentation, the information sometimes is not presented the right way. Only clinical data is kept. No knowledge is transferred at the IT system, which means that only the data is there. But if I want to say, okay, were we able to translate the knowledge of like the last generation of doctors into today's practice? We may say no. People, when they pass away or they leave a job, then their practices are gone. So there is no information system that is allowing to translate the knowledge, the way we practice healthcare to the new generation or from one place to another part of the world. Some information is not computer accessible still, although we have a lot of progress has been done in digitization of healthcare systems. No or little feedback to medical community and society. So there is a disconnect between what's going on in the hospital and when you go and see the doctor at the clinic and the communication with the patients when they leave the clinic. So when they leave the clinic, there is a big disconnect. People are not connected. Although now we have a lot of social media type of applications that allow us to reach the patient outside the clinics and the hospitals, but those social media are only, I would say, effective if the patient engage with you, because it depends on the way the patient, whether he wants to engage in the social media streams or not. But we want to develop new technologies using IoT and other technologies, smart homes and so on, that allows us to be connected to our patient wherever they are, not only for elderly, but for all kinds of patients, especially those that have complex diseases or they have a chronic diseases. So therefore, there is a complex decision-making. The knowledge keeps changing, medical errors, inefficient workflow, lack of training, no operational information, no common language that is used between the healthcare community. And the ultimate goal is we want to build intelligent healthcare processes that address the problems I just mentioned. I'm going to list only very few here. We need to have efficient information filtering, automated decision support, semantic-driven user interfaces that are intelligent and they know how to deal with the people based on their context, based on their history, and based on their preferences, what they have been doing, their daily activities, and so on. Remote data capture and analysis of data using social media and so on, etc. And then we want the interoperability between data and processes. We need to connect the processes to their data. We need to have that. The linking is the power in AI in healthcare systems. So here is just the, I want to show a little bit the opportunity for those researchers who want to do research in healthcare informatics, is that the market, the future market in healthcare informatics is huge. In 2016, there was only 39.46 billion. That was the cost, the evaluation of the market. Here I'm talking about those IT companies who are investing in health informatics. The market was 39.45 billions in 2016, and we predict that in 2025 there will be a market of 123.24 billion US dollars. So those wants to do research in healthcare informatics, the opportunities are there in terms of startup companies and so on, as you can see from these figures. And what is healthcare informatics? Is the, like this figure is showing here, is the union between people, all the stakeholders who are involved in healthcare informatics. And what is healthcare informatics is how these stakeholders can use the information in the best way and deploy the technology that can be applied on this information using science and processes. And here we're talking about all kinds of sciences and processes that can be that can help in order to provide better services to the healthcare system. So that's what healthcare informatics is all about. It is an interdisciplinary because the people who are, that I've mentioned here, are, in the previous slide, are people who are healthcare service providers, so the medical team, the support team, information, the IT guys, the people from computer science, software engineering, and also we have psychologists and other type of support services, managers from the business area and so on. So it's an interdisciplinary study, which is about the design, development, adoption, and application of information and technology-based innovations in public health and healthcare services delivery, management, and planning. So we want to provide a better healthcare service delivery, manage it properly, and plan it properly so that it is aligned to the budgets. So the healthcare informatics is often used to describe the full range of applications and research topics for which biomedical informatics and medical informatics are integrated together to solve crucial healthcare services. And by biomedical informatics and medical informatics, we're talking about, in medical informatics area, we're talking more about the data science. And then in the biomedical informatics, we're talking about AI as well as other technologies, as I'm showing here. So healthcare informatics is, the aim is linking the data to the processes. So a lot of data is available. We're going to see a little bit in a few slides what kind of data, the amount of data, the volume, the disparity of the data, the velocity of data, how it is changing, how quickly the data changes and so on, and how we can link that data to the processes, which are our healthcare processes, to provide best healthcare services. So we're dealing here with hypothesis validation, experimental designs, and most importantly, predictive medicine, preventive medicine. And the aim is to provide personalized medicine so that we know exactly what are the needs of each person, each citizen, and we know what are the issues that that person is dealing with in terms of healthcare. And then we can provide him with the resources to prevent things and predict what the most probable diseases that are going to be spread in a geographical area or in a city or in a country. And if we prevent them properly, then if we predict them properly, we can prevent issues from happening. So that's what the healthcare informatics is this the integration between these two areas. On the left-hand side, you have the medical informatics, which is dealing with the etiology, the pathogenesis, the clinical finding, the diagnosis, the prognosis, the treatment, which is the practices of healthcare systems. And on the right-hand side, you have everything related to the bioinformatics, which is the scientific concepts and the knowledge that we need to know about the physiognomy and the metabiology of the person, the transcriptomes, the proteomes, the genome of the patient, so on, which is everything that is related to the biology of the person, and the way the better understanding of that biology allows us to predict things and so on. So the aim here is how we can personalize the treatment based on the knowledge of the diseases and their I would say the causes of the diseases from the biological point of view. In order to do that, so as I mentioned earlier, it is an interdisciplinary where you have a lot of technologies: semantic web, artificial intelligence, Internet of Things, high performance computing, cloud computing, standards that are used in healthcare. All of these, if you integrate them properly, you will be able to provide new exciting horizons for building smart, scalable solutions in healthcare that can deal with large populations and provide global services. And here I'm showing some of the features that all this technology can provide in order to build those systems. Here I'm showing examples of such technology, example of what we do with this. So if you integrate this properly, you will be able to provide applications in this area. Outpatient care that is tailored to the patient needs, very efficient electronic healthcare systems that are updated, connected, easily integrated to. They can get the information from them properly, and electronic medical consultations, network-based community electronic healthcare systems, which are adapted to the different communities, their needs, their environment, etc. And we should be able to provide the services to elderly people at their homes, smart medicine from in different areas in medicine, and etc. So these are all smart emergency systems, and all of these is, as you can see, the heart of it is the Internet of Things, where we will be able to sense and to get the information, integrate information of different natures, and then use it for decision making and discovering new insights in healthcare patterns. So the need for artificial intelligence and big data is there. The health data is growing so quickly in size, format, and then also in the velocity, which means that it's changing every day. So that there is no longer possible for individuals to deal with such data, because it's a huge data. A person cannot capture that data, cannot identify the patterns based on his just mental capabilities. So we need large systems that can grab that data, mine it, and then get us some insights out of it. Interoperability of information from many domains require the use of AI for efficient decision support, predictions, preventions, as I mentioned. And here I'm showing a little bit the diversity of healthcare data. How diverse is healthcare data? You can see that there is data related to the pharmacy, drugs, drug descriptions, consumption of drugs, lab data, mortality data, social media data, hospital data, clinical claims data, the way we are making claims and then consuming the drugs, and because the drug consumption is very, very huge. I will show maybe later on that big budgets are spent on drugs, which is the medication and so on. So we have survey data. We want to connect to our patient, and all of these data is centralized around the patients and the citizens. In high level, we talk about citizens because we want to predict things to happen. So we are focusing on citizens rather than patients, because once you have the citizens becomes a patient, then it's too late. You have to spend whatever you have in terms of services to deal with that patient. We want to work on the citizen to prevent citizens to be patients. So the prevention is what the aim of the AI here is: predictive and preventive medicine. The big data, what is big data? Is a high volume that is changing every day with a variety of data. And these are what we call these information assets that demand cost-effective, innovative way of dealing with it, because it's no longer a small amount of data, it's a huge amount of data. So we are dealing with this data in an innovative way and innovative forms of information processes for enhancing insights and decision-making. And here comes the deep learning, reinforced learning, high-performance computing, how to integrate Internet of Things here, and so on. This all these smart technology are going to be connected to each other and then used in an effective way so that we can provide the scalable solutions that are effective, that are measurable, and that allows us to get some new insights and allow us to take decisions, mainly about what we call predicting things and then preventing things from happening. So the storage, as I said, it's a big data here. For example, I'll just give you an example. For in the genome, the genomics project, in order to take a single human genome, you needed 100 gigabytes of storage. And as in order to do sequencing of genomes, you need to play with millions and billions of the genomes of the same person. So that storage need to be grow from gigabytes, from 100 gigabytes for one genome, to terabytes, to petabytes, to exabyte, and so on. So it's a huge amount of data that we're talking about. Same thing for medical imaging, same thing for lab data and biochemistry data, and so on. All of these data is a huge in terms of amount of data. And now imagine that you want to integrate all of these data together to make some insights about the diseases, how they evolve, how to prevent them, how to treat them. And you're talking about a big storage of data. So
Professor
here
I'm sorry to interrupt you. This is Xiaohui Yuan. We're going to have to start our sessions. Basically, we are late 3 minutes. Is that possible you can conclude the talk in 2 minutes?
I'll try my best. Okay, yeah.
Thank you.
Yeah, there is a couple of applications that I will show. Maybe I will just remove those and then just conclude in a few minutes. So this is the pyramid of the healthcare big data processing. So at the bottom, you have all the source of data. Then you have to pre-process the data, collect it, pre-process it, and try to use some processing, statistical methods, and data mining, some query systems, intelligent query systems, and analysis of the data using a lot of AI techniques and so on, in order to get some knowledge. And then at stage 3, say we have the predictive and predictive techniques, visualization techniques, and the reporting techniques of this data. And then at the top of the pyramid, we have what we call the decision making. And here we're showing the same thing in a different way, just to use, we're saying how the data is transformed and pre-processed, transformed, and then data mining is done. And then we have the interpretation of the data. And then at the end, we have knowledge that we make use of it. And while doing all of this, we have AI, natural language processing, semantic web technologies, and other techniques that are needed in order to to do all this type of processing. And I'll conclude with this. So we have here the AI and big data is all about in healthcare is about predictive and preventive medicine. Preventive medicine is a mature research. We know how to do it. It's the study of knowing what happened. So if a disease has spread in a place, then we need to know what happened. So here we collect the data and we use the descriptive analysis techniques in order to understand what happens. Then we need to understand now, why did it happen? So once you understand exactly what happens, which is that you measure the impact of what happened, you need to understand why it did happen. And here we use patterns, data mining techniques. This area of preventive medicine is very well mature now in terms of research. What is challenging now is the predictive medicine. Okay, the predictive medicine is what the most of the challenges of AI in healthcare informatics is, that what could happen is the forecasting techniques, and here we use what we call predictive analytics. And what should we do to prevent what will happen in the future, and not what we call wisdom or predictive analytics. So these are this is the top, the most challenging aspect of research nowadays in healthcare. And some of the research challenges in this area is inferring knowledge from complex heterogeneous data sources, parsing and understanding unstructured free text, clinical notes, radiology reports, and so on, handling large volume of media and medical imaging of different nature, molecular, anatomical, functional imaging, etc. Analyzing the genomic data in a computational intensive task in an efficient way, capturing the patient behavior data through several techniques using wearable sensors, IoT, and so on. So these are the challenges of today predictive techniques. So I will just jump to the conclusion. So I was about to show some of the techniques that we use in deep learning for preventive medicine, but I think the time is not possible. So I'll jump to the conclusion and finish. So what we have to take from the conclusion here is the research area is multidisciplinary. Cross-disciplinary and multidisciplinary means that you need people from different expertise to work on one research team to deal with some of the complex problems that we have in healthcare. Most of the successful research in healthcare are those that include people from different specialization, and also they give the opportunity to students to integrate and exchange knowledge and use the recent advances in AI, IT, as I mentioned, the recent progress in IoT, smart systems, and so on, in order to integrate them in an efficient way to solve problems that are related to our communities. I would say here that the challenges is how to put those research groups to work together. There's a lot of progress in each area separately. And now the challenge is how you put all this knowledge that is AI and other type of research progress to put it integrate it in a multidisciplinary research teams to solve real life problems. That's the challenge in AI, big data, and healthcare informatics. Thank you for your attentions, and then I'll open the floor for a few questions if there is time. Thank you.
Do we have any questions for the speaker? I guess given the time frame, a lot of people have left for sessions, but I think this is an excellent presentation, give a very big an overview of our very important problems and opportunities in the field of for healthcare related to AI and big data. This is inspiring. Thank you very much, Professor Benlamri.
Thank you, and you are most welcome.